So let's take a look at each of these tabs individually in a bit more detail. You'll see in Judy's patient information tab there are a series of questions here about Judy herself, her age and her sex, and about her medication use, where she gets her medications from, how many prescribers she has, whether she thinks she's having any side effects from any of her medication. Down the bottom here there's information about things that might be clues to Judy having adverse effects from her medication. For example, whether Judy's had any falls that have needed medical attention. Down here there's Judy's blood pressure. So if Judy's blood pressure was low, that might be a clue that perhaps she's being over-medicated for her hypertension. And then the most important part of this patient tab, and really one of the most important parts of the TAPER-MD pathway, are Judy's priorities for her care. You can see here space for Judy to tell us about what's important to her in terms of the benefits of the medications and what's not important to her. So we asked Judy here which medicine she'd most like not to take and why. And this can often reveal medicines that are not important to Judy, but also it can reveal medicines that are perhaps giving her side effects. Then we asked Judy about her functional goals. So what are the things that her health stops her doing that she'd really like to do? And that helps us to prioritise which medications are most important to her. Then we ask her to list in order of priority which of the symptoms or illnesses that she has that are most important to her to have controlled by her medicines. And then we ask her if she perhaps uses medicines in a different way to the way that they're prescribed. And then the last question about Judy's priorities for medicines is about what she wants in a broader sense from her medicines. Does she just want medicines for relief of any current symptoms that she has, so to make her current life worth living? Or is it to prevent future illness by, for example, taking preventive drugs like statins or drugs for blood pressure?